HER Health Collective hosts 4 roundtables each year in an effort to bring together our experts and dive deep into the topics that matter to moms the most. We have found that these roundtables are often our most well-liked episodes. Each of the experts represented in our roundtables have different professional backgrounds and specialties. When they come together and discuss an issue pertinent to moms, you can expect to get different perspectives based on their area of focus. This is also a time for the experts to collaborate with professionals from other industries in order to create a more holistic model of care. Our goal is to expand not only the experts referral network, but to emphasize the importance of collaborative care. In our roundtable today, we are discussing healthcare through the different stages of motherhood, preconception, pregnancy, postpartum, perimenopause, postmenopause, and what moms need to pay attention to because it's not always obvious to us. We're going to gradually work our way through the various stages of motherhood, beginning with preconception, then on to pregnancy, postpartum, perimenopause, and ending with postmenopause. Today, we are honored to be joined by several of our HER experts. We're going to take a few moments to let each of our experts introduce themselves and share their area of expertise so that our listeners can hear each expert's voice and have a better idea of who is speaking during our upcoming conversation. So we're just going to start off in no particular order except for how you appear on my screen. And we'll have Brittni.
Hi, I'm Brittni Winslow. I am the owner and the executive director of Emerge Pediatric Therapy and an occupational therapist by trade. I also own the Therapeutic Edge Collective, which is an online continuing education resource center for pediatric providers.
Hello, everybody. My name is Dr. Courtney Hinton. I am the founder and CEO of the Snatchback LLC, which is an entity that provides the pathway to healing for historically marginalized birthing people who are recovering from the NICU and premature birth. Along with that, I am the interim medical director of North Carolina State University Campus Health. And so I'm happy to be here with all of you today.
Hi, everyone. My name is Kate Williams-Stone. I am a non-diet health and life coach focused in perimenopause. And so what that means I help women do is to calm the mental chatter around all the perimenopause symptoms, like what the heck is happening to my body right now, so that you can feel at home and at peace in your body. I have training in intuitive eating, body image work, and I take a non-diet approach to healthy habits. So I'm so glad to be here.
Hi, everyone. I am Rachel Jerozal, better known as Dr. Rachel. I am a doctor of physical therapy and owner of Durham Pelvic. As you can likely tell by the name, I am a pelvic health physical therapist, and I'm located in Durham. I see patients one-on-one in my practice, and I work with women all the way from preconception through pregnancy, through postpartum, all the way to menopause, and just all the pelvic floor issues that arise during those states. I'm here to help support because you don't have to live with them. So I'm happy to be here today.
Hi there. My name is Megan Davis, and I'm a licensed clinical social worker and certified perinatal mental health specialist. So I'm in private practice in Raleigh, and I work with, I say moms across the lifespan because I see a lot of moms who are newly pregnant or in the postpartum period. But as we know, postpartum doesn't really ever end. So I'm happy to be here.
Hey y'all, my name is Dr. Brook Orvis. I am a board certified pelvic floor and women's health physical therapist. I am the owner of Flora Physical Therapy in Durham, North Carolina. So again, I really work with everyone that has pelvic floor issues, which is everyone. We all have a pelvic floor. Everyone poops, pees, and has sex. So I'm really passionate about providing equitable care to folks and just helping to support people, especially people that are trying to conceive during pregnancy, postpartum, menopause, perimenopause, because those are prime time for pelvic floor issues to pop up.
Hi, everyone. I'm Christy Lowry, founder of the Parents Table, and we support those entering and exploring the early years of parenthood with online and virtual personalized coaching and community. So I'm a personal growth coach for parents, and I focus on the parenthood transition, basically from pregnancy to preschool, like Brooke said, and Megan said, I believe. it's a longer transition and takes longer than we think it does. In that time frame, I come in with systems for personal growth, parental leave planning at work and at home, creating shared and strengths-based and equitable division of labor at home, and grieving many things. Grief is often not talked about enough in this postpartum phase. So I like to bring that in, and then also rediscovery of yourself in this often messy transition. So I'm also very grateful to be here today. Thank you so much for having me.
Hi, I'm Allie Raven. I'm a certified birth doula, childbirth educator, and breastfeeding counselor here in Charlotte. I own Allie Raven Doula Services, so I specialize in pregnancy and labor support for all of my expecting parents, and I also offer childbirth education courses. I also just started a birth partner course, which is aimed at birth partner support and teaching the birth partner how to be a good support person. I'm excited to be here. Thanks for having me.
Hi, I'm Stephanie Opper. I am a licensed esthetician and I own a skin spa in Wake Forest, Sensational Aesthetic Skin Spa. And I work with women and actually young women of all ages through all phases of life. And as I'm discovering myself with my changes in my skin and everything else going on, but working with women to really get through those challenges of all the changes happening to their skin and their body as well. I'm really excited to be here because there's a great group of expertise here.
It is such an honor to welcome all of you to this roundtable, and we're going to go ahead and get started with our first question, which is going to be on the topic of preconception. So preconception refers to the stage prior to conception. It's during this time when an individual's health can be assessed to determine if there are any medical conditions or health concerns that may affect the future pregnancy. Dr. Courtney, I'm going to direct this to you to start off with. As a board certified physician, will you please share when it's best to begin receiving preconception care and what an individual should pay attention to in regard to medical conditions or health concerns and their physical health?
Absolutely. So I am a firm believer that preconception care starts way earlier than any of us often think about. I think for someone that is seeking parenthood at some point in their life, you can actually start about preparing for conception many, many years prior. And it also can be very specific to the person. As an example, I mentioned that part of my work is working with college students. There are plenty of students currently that I see who have no interest in being parents right now, but even if they're seeking that a decade from now, the types of medication decisions and chronic disease management that I'm doing with them now, if I'm starting them on a medicine that they may be on for the next 20 years, then I'm already thinking about making sure I'm choosing something that is going to be healthy and consistent with a pregnancy in the future. It's also important to think about what it looks like if they have to come off of that medication in the future. A good example of that is going to be something like medications for various mental health conditions. There are some that are studied way more than others when it comes to how they impact a pregnancy, both for the person carrying the child and for the child themselves. And so I often today am having conversations about what that research looks like so that future mothers, future parents can make informed decisions about the things that they take. Another great example of that is going to be thyroid disease. Thyroid disease is very, very common in our community. And one of the things that a lot of people don't know is that once someone is pregnant, your thyroid medication, absolutely, you can expect that it's going to be different as you move through that pregnancy. That has to do with that hormonal shift that occurs that can impact the thyroid. And it's common that your dose actually changes and increases during your pregnancy. But if someone is not prepared for that or asking those questions, then, they can worry that that means that they're just getting sicker, as opposed to the body kind of physiologically responding the way it should during a pregnancy. So ultimately, when I think about when should preconception care start, really, I think as early as possible. And what we as future parents can do for those that we care for is to make sure that you're asking questions early, that you're going to get your physical every year, that you are not thinking that because you're healthy, you should only go when you get sick, right? Making sure that you have a healthcare routine established way early on makes it much easier to get the care that you need when ultimately there is a pregnancy to be thinking about. So my overall answer is as early as possible.
That's all a wealth of information right there, Dr. Hinton. Thank you so much. And I'd love to direct my next question to Dr. Brook or Dr. Rachel, if you would like to jump in as well. Is there anything that we need to consider preconception-wise with our pelvic floor as we consider conceiving a baby?
So I see a lot of folks in the clinic that are coming in for different types of pelvic pain. And we know for folks that are struggling with pelvic pain that there potentially is going to be issues in terms of the sexual response cycle, which is really, really important for folks that are thinking about trying to conceive. We know that the pelvic floor muscles are really important during orgasm. We get a contraction and a release of those muscles with orgasm and just sexual response, and also contraction oscillation of the uterus, which again is really important when it comes to conception. So a lot of times people that are coming into the clinic working with me, a lot of times we're just kind of working on addressing any type of pelvic pain that they might be struggling with. Because again, it's like if you aren't enjoying yourself when you're trying to be intimate with your partner, like it makes sense that you probably don't want to be doing it and having sex and intimacy. And so for a lot of people that I'm working with, that the end goal is, okay, I'm trying to get pregnant, then we obviously need to address the underlying issues of why they're having the pelvic pain and tension in the muscles and potentially those hormonal changes, which is where lovely physicians like Dr. Hinton come into play with having those conversations with clients too.
Wonderful. Thank you so much, Dr. Brook. I also would like to take this and look at it from the mental and emotional considerations that we have to keep in mind prior to pregnancy. I'm going to actually direct this to Megan. If there's anything that you can think of, there are so many life events that can impact a person's mental and emotional health in the preconception stage. Will you please share some things that we should keep in mind for mental health prior to conception, and perhaps share some tips to prepare for the parenting journey with our mental health?
Even just in the preconception stage, as Dr. Courtney mentioned, the medication that some individuals are on for mental health reasons might need to be changed. And so just being aware if that is the case, and to have a good support team with a therapist, psychiatric provider, other medical professionals to provide that support, because for some people it can be a pretty difficult transition coming off of medication that has worked well for them. Also, something that I see a lot is a lot of anxiety around just trying to conceive. And oftentimes, if we are kind of like high achievers and, have our plans and we are very organized, trying to conceive can be a real stressor and really difficult to cope with, because it is something that to a large degree is out of our control. So just kind of having support, whether it's through, talking with a mental health professional about what that's like, learning some ways to really kind of be able to sit and tolerate the uncertainty around the actual process of conception can be really helpful.
Thank you so much for that, Megan, and everyone that gave us some insights to that preconception stage. We're going to shift over now into prenatal care. The pregnancy stage of motherhood is a time when an individual goes through tremendous changes, both physically and emotionally. And let's be honest, it is wrought with so much emotion. It is up and down and scary and exciting and completely overwhelming all the time. So it's a really important phase that we spend some time exploring and touching on. Hormonal fluctuations are a huge aspect of what an individual is going through during this time in this stage. So we touched on the pelvic floor health and the mental and emotional health with with preconception. And I want to touch on that again in this pregnancy phase because it's such an important piece. Dr. Rachel, this is directed to you. The pelvic floor has started getting some well-deserved attention over the past several years. Thankfully, we all need to know about the issues that arise with the pelvic floor. It has become much more studied. It has a huge impact on the person's life, and we're seeing it in the news and social media more and more. Will you share with us changes that the pelvic floor experiences at this stage during pregnancy, as well as some common issues that a woman might experience?
Absolutely. I'm so here for the pelvic floor getting more attention, as I'm sure Brooke and honestly everybody in this room is. So during pregnancy, there's two major shifts that affect our pelvic floor. And the one you had spoken about, Christy, is hormonal fluctuations. So that doesn't only affect our mental health, it also affects our physical being. And I know everybody hears about relaxin, but there's other hormones than just relaxin that do make the pelvis more mobile. And that's a great thing, that prepares us for birth. However, that can take away a lot of the inherent stability that our bodies have prior to conception. That can just bring up a lot of symptoms such as pain, such as leakage, such as, core weakness with the diastasis. Diastasis is just an opening of the abs, which is completely normal during pregnancy, but it does make us a little less stable. So there's kind of that factor. And then the other factor is you're gaining a lot of weight, and not only, you do gain widespread, but it's very centered in the belly, which means the pelvic floor is having to support it. And so our pelvic floor normally supports our organs, but during pregnancy, we have a very heavy organ that's getting heavier and heavier as we progress through pregnancy. And so the pelvic floor might have been totally fine pre-conception, and then with all this extra demand it's being placed under, we're starting to see those symptoms crop up. So the biggest thing that I want to say to the mamas here is, or the people hoping to become mamas one day, is that oftentimes we're given this advice like, oh, it'll get better after pregnancy. Like, just, that's pregnancy. You'll figure it out after. And I and Brooke, we work with people during pregnancy to help you feel as good as you can feel. And certainly there are always those things that it's like, oh yeah, I had this weird rib pain and it just completely resolved after I gave birth, of course. But there are a lot of things that can get better and better through working with a skilled physical therapist. And you don't have to wait. You don't have to suffer all through your pregnancy. You can work with us. And then there's more to it than just Kegels. So please don't just say like, I'm just going to do my Kegels, I'll be fine, because that is not always appropriate.
Thank you, Dr. Rachel. Yes, the whole don't just do Kegels is such a valuable, I remember pulling up to the stoplight and let me do them because that's what I heard on the radio I'm supposed to do. So thank you. I think that's a very important message because I am not a person that is supposed to be doing Kegels. I'm going to turn this over to Megan now for the mental and emotional health piece. Will you get us started discussing the mental health considerations that we should be paying attention to during pregnancy? How is knowing how to advocate for oneself and understanding perinatal mood and anxiety disorders important at this stage?
1 in 5 birthing persons will experience a perinatal mood and anxiety disorder, and non-birthing persons, it can be 1 in 10. So it's definitely something that is gaining more attention with advocacy, which I think is really great, that more OB practices are screening, but they don't always know what to do next. So it is really important to be your own advocate. And if you feel like you can't do that, see if your partner can advocate, at appointments. But definitely some things to take into consideration are if there is a history of a mental health diagnosis, specifically depression, anxiety, OCD, bipolar disorder, things like that. That's something that is a risk factor for a perinatal mood and anxiety disorder during pregnancy and postpartum. So it's really important to get connected to a mental health professional who can just kind of keep an eye on things and check in, because along with all of the hormonal shifts, there are just so many changes that even those of us who might not have, a history of depression or anxiety or anything like that, it's a lot to navigate. So having that extra support can be really helpful. If there is any type of history of sexual abuse or trauma. That's also an important consideration, making sure that you find an OBGYN or a practice that's trauma informed and can really be there for you in ways that are helpful. That's also where I think having great doulas, are important to help advocate as well. But at any point, if you are starting to notice that you're just not feeling yourself, you're maybe having a lot more difficulty sleeping or eating or trouble concentrating, things like that, or even noticing any type of like suicidal thoughts, definitely reach out. And a great organization is Postpartum Support International, which has both a warm line and a hotline, and they have a abundance of resources and support groups. So it's really helpful to start getting established during pregnancy, because a lot of mental health symptoms can really start during that time that might not have ever been there.
Such important information. And yes, PSI is a great resource. Thank you for mentioning that. We will definitely make sure we link that in the show notes for anybody that needs it.
So a lot of what Megan said really resonates with me as a doula, because a lot of what I'm doing during pregnancy is making sure that my clients are reaching out to their therapists and to their mental health providers to make sure, I am not a medical professional. I am here to support you and educate you on childbirth and prepare you for all of it. But at the end of the day, having that relationship with your therapist throughout pregnancy and preparing you for being prepared mentally for childbirth and postpartum, it's hard to understand how much of an impact that support and help is in the prenatal space and how much it impacts going into postpartum. And PSI, I give that to all of my clients, and I'm like, just look at it, please, because it's one of those resources that you don't know that you need until you need it, or until after you already need it.
For moms that have births, unfortunately, that do end up with babies in the NICU and or any sort of prematurity, everything that's been said is times 10. I think particularly, so for my own background, I am a mom of former NICU babies, twins, and I will say that it's so important to establish care if you don't already have mental health support during pregnancy. As soon as that unexpected event happens, it is imperative to establish that care before you even realize that you need it. Like, do it even if it's not something that is resonating with you yet, because the fallout emotionally from that is tremendous, and it's something that you can't anticipate. And in those early phases, particularly if baby is in NICU having difficulties, so much of your focus is on just the minute to minute of what's happening there, that it's easy to say, I'll do that later. And the unfortunate part is you really need it immediately. You really need that support right away. So I just really want to say it's so important for all mothers. And in situations that have those unexpected things that you just can't prepare for, I mean, truly, day one, I would contact someone for that support, because you're going to need it. There's a lot of grief. I know Christy mentioned grief early on, and there's a lot of grief that comes in that phase. So I just wanted to really push everything that has been said so far.
There is so much in this particular stage. Brittni, I know that sensory-wise, things change in pregnancy, hormones change, it changes the way that we respond to everything around us. Do you work with people in pregnancy? How would someone's sensory response change when they are building, creating, growing a human inside of them?
Yeah, so there's definitely tremendous changes that happen, I think, during pregnancy because of the hormones, like you said. And then especially then before you have children, you might be managing your sensory overwhelm and not even realize that's what it is in different ways by just how you live your life and the choices that you make. And then moving into then having a newborn, it's a very sensory rich experience. So we do not typically get referrals for women who are pregnant, who are wanting to kind of address that early on, but it would be fantastic if the trend moved more in that direction, because if people better understood how sensory input impacts their day-to-day life and what those triggers are and how to manage sensory sensitivities than being able to go into a very sensory rich experience when you are very low on sleep and you're likely not meeting your own basic needs because you're taking care of someone else. Like it just, you need to have a strategy going into it. So you can obviously get a strategy in place once you're in that phase of having a newborn, experiencing that world. But it would be so incredible and so powerful if people had that prior to going into it. Because honestly, we see a lot of parents now that their children are older, they're 3, 4, 5 years old, and they're starting to just understand that some of the issues they've been dealing with are related to sensory processing differences, because there's just so much more dialogue around that now than there was before. So yes, huge advocate for people being able to figure out what works for them as early as they can.
Thank you so much for that. And Stephanie, I would love to get your feedback on the skin. The hormones not only change us internally and our moods, but I have to say, when I was pregnant, I noticed a lot of spots all over my body. And I was just hoping that you could talk a little bit about skin changes that happen during pregnancy.
That is really something that I see a lot of. So I have clients that come to me that are expecting and dealing with all of those hormonal changes that create pigmentation. So we hear melasma and pregnancy mass a lot, and that does happen. Well, newsflash, it actually happens all throughout now with all the hormone changes, but during pregnancy, it's a big thing that does happen, and we experience that. And we have to be careful on how we treat it. And fortunately for most, it does go away or lighten when your hormones balance back after you have your children. The other piece, though, is I'll see clients that have acne. So they'll come to me and they're so frustrated because they've never had acne in their life, and all of a sudden they're expecting, and now they have all of this congestion and they don't know what to do. So there are things you can do. So taking care of your skin, getting your skin healthy before pregnancy, during pregnancy, and then after as well. All those phases of life, keeping your skin healthy, just like you're keeping the rest of your body healthy, so that it can respond better, instead of all of a sudden you have all of this acne or all of this pigmentation and it's just exasperated because of these changes that are happening. So taking care of your skin at home, taking care of yourself as well by, doing skin treatments and things like that. It's all really great self-care.
We'll be talking more about the skin changes later on because, yes, as you become perimenopausal and into menopause, there's more things that happen to our skin. So we'll be touching back with you. The next phase that we're going to go into is postpartum. And the National Library of Medicine defines the postpartum period as, quote, the period after delivery when maternal physiological and anatomical changes return to the non-pregnant state. Some professionals say 6 weeks to 6 months, that's the postpartum period. This is a pretty arbitrary number. I personally believe that once you're a mom, you're always a mom, and that you're always postpartum. We can discuss that more if you'd like to, but let's explore healthcare through this stage of motherhood. It's a time of so many changes and adjustments. You now have a human that you are responsible for. So Allie, I'm going to come back to you. How does the childbirth experience impact a mother's mental health, both immediately after childbirth and moving forward in the parenting journey?
We all know that childbirth can be fun and exciting and beautiful, but it can also be very scary and very unexpected. So having a birth experience not necessarily going as you planned or as you had hoped it would can be a little bit detrimental to a lot of people. So a lot of times when you're looking at, how is your experience impacting your mental health, we talk about, or I especially talk with my clients about how their birth experience was for them. And we can prepare all day long. We can make your birth plan, and I can help prepare you for every single scenario that may or may not happen. But at the end of the day, most women have some kind of idea in their mind of how they want their birth experience to go or how they hope it will go. And during childbirth, if it doesn't go like that, or if it does go like that, if it goes perfectly as they had wanted it to, as they planned, then that may either help or hurt their postpartum period and their healing postpartum. So big one is obviously for women who plan to have an unmedicated birth or a vaginal birth, and then it turns into a cesarean. It's very common for a lot of people to feel like they almost failed as a mother or failed as a woman, that their body wasn't able to, let's say their cervix wasn't able to dilate, or they weren't able to push their baby out. So if their birth didn't go as they intended and they had some unexpected things come up during that birth, then that will lead them to feeling like they may have failed or like they are not worthy of being a mom to their child. And that plays a big role in their recovery postpartum, because if you are constantly trying to make up for how your birth experience was, or if you're trying to find ways to replace your birth experience, then that can lead to a lot of mental health concerns down the road. And that's why, again, it's so important to have that mental health connection in the prenatal period to help give you those foundations that you will need leading into postpartum if your birth doesn't go as planned. Also, something that may not be focused on a lot, but is just how physically tiring childbirth can be. And a lot of people don't realize that going into childbirth unless you've done it before. You don't realize how physically tiring it can be. So going from having a kid, being in labor for anywhere from 2 hours to 48 hours, when you are done laboring, you still have to be responsible for a child, and you still have to be awake, and you still have to be focused. So if you have an experience, like I mentioned before, where it didn't necessarily go to plan and you feel like you may have failed, or you feel like you aren't good enough, then you may be trying to find ways as a new mom that you can counteract that failure that you feel, or you may be searching for ways or have fears that you're going to fail being a mom too, since you may have failed birthing your child. The last thing I'll talk about is a lot of people stress about the immediate skin to skin period, which is tremendously important. I always recommend that all of my clients do the golden hour, but for some women, you don't get that opportunity. So whether you had to have a C-section or something happened where they had to take baby away very quickly, some women lose out on that immediate skin to skin and that immediate bonding period. And for a lot of people, they have to grieve that. And they don't understand, or they don't feel like they're able to grieve it because they have to now be a mom. Making sure that they have that space to grieve it. They understand that, yes, you have a healthy baby. You are healthy. And a lot of people will say, okay, well, your baby's fine, so it's okay. But you're still allowed to grieve that period and grieve what you lost. And having that support system around you that understands that you need to go through this grieving period to be a healthier mom, to be a healthier parent.
Go ahead, Dr. Rachel.
I just wanted to say that, and hopefully we're moving away from this, but I know there's that 6-week checkup at your OBGYN, and just people get this in their head about like 6 weeks, I should be back to normal, whatever that is, even though we've discussed that you're a whole new body postpartum, and 6 weeks is so fresh, you know? So I actually put the rehab, the back to normal feeling at more like 12 to 18 months. And when people first hear that, they usually, their jaws drop and they're like, what? I want to go back to CrossFit at 10 weeks. And, you know, that's a grieving process as well, because if you weren't educated on that, and if, you know, you have a gym community or that's a big part of your life, it can certainly feel like you're just super out of touch with your body. And that can be very frustrating. But I just, please give yourself grace, because, you know, you just grew and birthed a child and now you're taking care of a child. So, you know, it is not 6 weeks to be magically rehabbed. And certainly we hear those stories of people who bounce back, but those are the exceptions. And Brooke and my practices are filled with people who do not bounce back, because that's normal. That's very normal to have to rehab your body, especially if you've had a C-section or if you've just had some birth trauma where it wasn't as smooth of a birth as you could have. You know, certainly that's an injury, and we're rehabbing. So please give yourself grace. Postpartum, give yourself at least a year, if not more. So
absolutely, Christy.
Okay.
Yeah.
Thank you. Yeah, I think there's both of the things that you hit on is the timeline and grief, and timeline and time frame of postpartum. I feel like once I started to learn about horticulture time versus industrial time, I really understood that my pregnancy and my birth experience and my postpartum experience wasn't on this fixed timeline, because I am not a fixed person and I'm a very variable human being. And so, when we look at horticulture time and women's bodies, we flow with the moon, we flow with the seasons, we're energetic beings. We are not on this Monday, the 8 to 5 industrial time. And that's what it is. And we get so focused on things have to happen in 8 to 5, things have to happen on this due date calculator. The company policy on parental leave is when I'm supposed to be back and ready to go. The 6-week checkup is, I'm good to have sex with my partner, right? Like, things are great, we're moving. No, you have to step back, you have to pause, and you have to feel that intuition and find that knowing within to say, okay, am I ready for this? And start getting curious with yourself and kind of become your own detective and your own advocate in that way. The other piece that I love hearing, and I love talking about grief. I know that's very odd, probably, but I think it's a really special and meaningful and important piece that we do not talk about enough, and we don't know how to experience because of the lack of communication and visibility in it. And, when something doesn't go the way you hoped or that you planned, there is going to be grief and you're going to yearn for that experience. I work with motherless mothers based on my own experience and those who have lost their mothers before and after birth. I lost my mom after birth. And there's a whole host of experiences and circumstances and complications that come with grief in that respect, but also just grieving what you used to have in this postpartum life. There's a lot of changes we're going through, and whether you had an experience in your birth or with your baby or whatever the experience was that didn't go right, you're also yearning and grieving the life that you had before you were a mom. And so just allowing those things and those emotions to come up in addition to your birth experience in the postpartum phase.
This is Megan, and I just wanted to add in, I could talk about this probably for like 6 hours, but I'm going to spare y'all. Yeah, I think in the postpartum period, so many moms can feel isolated or just not know, like, is this normal? Is this not normal? And definitely if you are noticing that you're feeling off, just not yourself, especially after the first 2 weeks postpartum, like, there is help out there. And whether it's getting on some medication or getting into a pelvic floor PT or getting mental health support or whatever it may be, a lot of moms can really notice improvement in the postpartum period. But also another piece of it is really just loading on the self-compassion, which is a practice. There's this concept of matrescence around becoming a mother. So it's not just birthing a baby, but birthing a mother. And there are so many different physiological changes. Our brains literally change as well. And on top of that, we get a lot of different messages from society about what a mother is or isn't or should or shouldn't do. So these are all different things to just really be kind to yourself, because it is a lot of change and there are a lot of different messages that can kind of cloud the skies. So definitely get in to speak with a mental health professional, or just find a group of moms who you feel like you can be really real with.
Thanks so much, Megan. I'm going to circle around to Brittni. We've talked a lot about the different changes that happen once you have the baby. It's a pretty intense time. There's lots of big emotions, and now you have a lot of additional responsibility. Also, irregular sleep. So this all compounds to some major sensory overwhelm. And I was just wondering if you have tips that you can provide us where you can tell moms, here are some tips to manage your own sensory overwhelm.
Yeah, absolutely. I mean, I think when we think about sensory overwhelm, we kind of default to thinking about overstimulation in, some of, basic senses, right? So things are too loud, you're touched out, there's just a lot of that happens that contributes to that sensory overwhelm piece. And so for that, it's being able to recognize and taking that time to realize, okay, things are really overwhelmed or things are really loud. I'm getting overstimulated by this. It's okay. Giving yourself that permission to then do something to, like, is there a place I can go? Do I need to set the baby down in a safe space or have someone else with the baby so that I can walk away and I can try to regulate my nervous system? Communicating that. I think that a lot of parents think that they're just are being labeled as just being like too much or, dramatic, or, you're having this really big reaction, and there's no acknowledgement of the fact that of that extreme nervous system dysregulation that's happening. So having conversations, with your partner, with people that you trust, to help build that language, build that safe space to say, like, I am touched out, I'm really overstimulated, I need X, Y, or Z. So I think first comes with communication, acknowledgement, taking some time to examine what works for you, and knowing that my body is different as a parent now versus pre being a parent. So I could go to loud concerts and I could have the bright lights, and all of those things were fine for me at one point in my life, but that has really changed for me now having 3 kids. And so giving yourself that space, I think the grief process, I think that's also a tie in there. So I think focusing on that, what are my triggers? What is too much? Accepting that that's the case. There's things you can purchase like loop earplugs that help to decrease down the decibels in which you're hearing and experiencing your space. You can think about modifying your environment, turning lights down. There's a lot of different strategies you can do that way to really think about, how can I model this to support my own sensory system and what my sensory system needs. And on the other side of that, a good way to tackle sensory overwhelm is to think about what is regulating to my nervous system. And so the proprioceptive system, getting a lot of good input through your muscles and joints, is naturally going to be regulating for all people. So you think about yoga, taking a walk, just being able to get away and just, again, examine yourself as a person and realize, what does my body need to feel just right? And then building in opportunities, use your village, find ways to be able to get a lot of those types of sensory experiences that are going to regulate your system. Because for me, if I'm feeling overwhelmed as a person, I am touched out, too loud, too bright, all the things. I know if I just go for a walk, it doesn't have to be strenuous. I am going to get some sensory input that is going to make me a better mom, a better spouse, a better boss. So we have to be able to put ourselves first sometimes, be a little selfish, understand what our body needs, because we're not going to be able to be our best selves for those that we're taking care of and supporting if we are not feeling just right in our own bodies. Empowering people to do that.
Thank you so much for that, Brittni. I think that's a really important message to hear in that phase and in all phases.
Something that you have said of just taking time for yourself and being selfish. Being selfish is not selfish, I guess, when you need that care and you need to value your time and you need to rest and all that you need to do and notice your needs. But there was a study when you were saying that came to my mind about how the inequity at home that we see and how much that's impacting mental health and the ability to rest as moms and get that time to ourselves, right? And so the study is called Cognitive Household Labor, Gender Disparities and Consequences for Maternal Mental Health and Wellbeing. It's a very long name, but if there's a transcript, maybe you can search it. This time for yourself is imperative because it impacts not only you as a human being and your mental health, but it will transpire, in your home, with your kids, with your partner. And so having that shared responsibilities, shared systems with your partner, or if you don't have a partner, with your care network, your neighbors, your family, your friends, is really important, and it's okay to ask.
Absolutely. Thank you for sharing that, Christy. We're going to veer over into perimenopause now. And Kate, I'm sure you can maybe discuss this with me a little bit, because I'm sure you have a more positive view maybe that you can leave us with, because I happen to think that perimenopause and the timing of it feels really like a cruel joke, because for most of us, we just wrapped up childbirth and having kids and all the hormonal fluctuations. And then we're maybe just starting to feel like we're getting back to ourselves. And I'm not even talking about physically bouncing back. I'm talking about like, I'm back to the human I was before all of this childbirth stuff happened. And then, perimenopause is knocking on the door. So I'm very excited to talk about this with you, Kate. Often described as menstruation in reverse, perimenopause brings changes that are minimally spoken of, and there's a real lack of understanding. I feel like, just like with pelvic floor PT, we're starting to hear about it a little more. We have wonderful people like Kate on social media posting about it, that we're able to start learning about it. But when women have these symptoms and start to show these symptoms, they often feel alone, and in many cases are being dismissed by doctors as just being, oh, get more sleep, you're stressed, I think are the two that I hear the most. So Kate, this question is directed towards you initially. How does a woman know if she's having perimenopause symptoms, and how can she find the guidance that she needs?
Oh, it's such a good question. And I love this point, Chrissy, that you brought up, especially as women are having children later in life. It is not uncommon to go right from postpartum hormonal changes right into perimenopause, or for them to even be overlapping. And I don't think that's on women's radar postpartum. And so symptoms can start as early as 35. I usually say like 40-ish, is the time to start getting educated. The average age of menopause, which is defined as 1 year, no cycle, the average age in the US is 51. And perimenopause can be 7 to 10 years before menopause. So if you're over 40, it's the time to start learning about it. And, hearing so much about pregnancy and postpartum, the next big hormonal change that you're going to go through is perimenopause. And just hearing the conversation about all this amazing support from all these experts, we're just now starting to get the same kind of support around perimenopause. And sometimes I call myself a perimenopause doula. That's like the easiest way to describe what I do. It's the support, it's the education. Yes, you have a doctor, but there's so much more to this conversation than a physical medical appointment. And there can be so much more in your toolbox as far as support and resources. So this question of, is this normal? Is this not normal? It comes up in pregnancy, but it totally comes up in perimenopause symptoms too. And I think we have this concept or this vision of menopause being like the Golden Girls. And so then I look in the mirror and I'm like, that's not me. Like, I am cute and 47. I am not a golden girl, right? So this menopause conversation cannot be for me, right? But it is for me. But our vision of like what age looks like and, our perception is so skewed. And then we have this stereotypical version of like what symptoms look like. Right? Like that it's just like being hot and sweaty, like a golden girl, like in Florida, like fanning yourself. And it's, yes, hot flashes, but it's so much more than hot flashes, and being educated around what those things are. And before I list some of those common symptoms, I think it's also really important to have a conversation with your medical care support team. There's so many symptoms of perimenopause that overlap with other health conditions. So let's rule out those other health conditions first before we say this is all perimenopause and just blame it on perimenopause. So things like thyroid, iron deficiency, low vitamin D levels, like mental health crisis, that can all be a part of this, an adjustment of mental health medication, right? Because it's really hard to untangle what is mental health, what is perimenopause, what is recovering from a pandemic, is a question I get all the time. And the truth is, if you're over 40 right now, we will never untangle what is a stress trauma response from living through a pandemic and what is perimenopause. Like, they are intertwined for us. They always will be. And it makes it a little bit more nuanced to navigate. So some of the symptoms you should know about: brain fog, change in cognitive function, focus, ability to get things done, fatigue, mood changes, And those mood changes can look like increased anxiety and depression. We know with the decreased levels of estrogen and progesterone, there is like an experience of almost just being less stress resilient, right? Like the things that you used to be able to like handle a million things at once, or someone could ask you something, all of a sudden that thing that someone asks you to do at work is like enraging to you, over the top, right? That can be linked to hormone changes. There can be an experience of kind of flatlining. It's not that you're really anxious or depressed, but like nothing really gets you up or down anymore. Like you just kind of feel dull or numb in some ways. Sleep disturbances are another big one. So that can show up like trouble falling asleep, trouble staying asleep, waking up at 3 a.m., that is like very perimenopausal. So that can be part of it. Low libido and sex drive, vaginal dryness, just general like joint aches and pains, muscular skeletal stuff can be going on. Night sweats, which is like waking up in the middle of the night, just drenched to the point where you have to change your sheets, or you think like, did I pee myself in the bed? Like it's so wet. And I think, all of these come with giggles, but it's like so important to normalize the experience. There's nothing wrong with me. This is a normal hormonal transition that my body is going through. And there are ways I can relieve some of these symptoms and to have support, right? So there are like other medical things that you can explore, like hormone replacement therapy and different medications, but also just the psychological piece of like, is this normal or am I dying? Which is like the question that comes up for women a lot. Is this something serious or is this just perimenopause? The other thing I want to just call out is that perimenopause is a peak time for eating disorders. So if you have a past history of disordered eating disorder, which we see is very common in teenage girls, perimenopause is another time where that can show up. And so just to be aware of that, especially when body changes happen, like weight gain, increased belly fat, just changes in body distribution, which we also know is normal and related to hormonal changes, that can awaken this past like disordered eating voice or experience. So something to be aware of. So that's just your brief introduction. I like to call it the health sex talk that no one's giving every woman over 40, that we all need to have. And my two pieces of advice are: don't wait until your first missed period to start learning about menopause. And if you're not already, start tracking your cycle now, because that baseline of information can give you a picture of hormonal changes as you go forward. And then I'll just shout out two resources that are really helpful. If you're looking for medical care providers with further menopause training, menopause.org is a great resource. And there's other information on there. And then I also do have a free guide on my website that lists all of these symptoms if you're interested in downloading it. So that's just my name, katewilliamstone.com/guide. So those are some resources to get you started.
Thank you so much, Kate. I really appreciate that. And it's good to hear that it is normal and we're not alone and there's help out there.
I know. I mean, I do really think that this generation, we are the cycle breakers. Our moms and our grandmothers didn't talk about this, and we're the first generation that's starting to break down the stigma and just like normalize the conversation. And soon we'll have medical research on female bodies to bridge the gap to really know like what is going on. And in the meantime, by just having the conversation with each other, we can create a lot of healing and normalization between ourselves as peers, as friends.
Oh, absolutely. It's really powerful to have that community around it. I want to turn to another piece of this stage of life that hits home. And that's when we begin to recognize more obvious signs of aging, specifically on the face. I'm looking at you, wrinkles. Stephanie, I want to talk to you a bit. Would you please share what's happening at this stage? And I am all ears. Provide us with some tips as we navigate the changes in our skin, perhaps more wrinkles, perhaps change in skin tone. I know that these things are common at this stage. So what can we do? Please, we're on the edge of our seat.
Yeah, absolutely. So I'm so energized by this conversation too. And I do love that we're breaking the cycle, because I like to say that we're, be pro-aging. We're not anti-aging. We want to live and we want to do that, but let's do it gracefully. We're experiencing all of these changes, and what can we do? Well, self-care is not selfish, although we feel that way, but you can take care of yourself and feel good about yourself and feel good as you're entering those later stages in your life. So that's one thing, is pro-aging is being proactive and taking care of your skin at home. So do those general basic things: washing your face, using moisturizer, using serums to protect your skin, using SPF every day, no matter what. Start your children. We're, instill those things in them as earlier, so that as you get to this point in life, we're already doing these things and it's second nature. But a lot of my clients will come in, and once again, in this stage of life, they're having acne. Their skin is so sensitive due to hormones. Hormones drives a lot of changes and sensitivities. A lot of clients come in with rosacea and just dry skin. And so just making sure that you understand, it's not, oh my gosh, I should have perfect skin. I've had perfect skin all of my life. Well, accept those changes are happening. Hopefully you're working with your other providers and understanding what's actually happening within your body as well. Because if you're not taking care of that, well, then the stuff that's going on the outside is not going to resolve itself with just a facial, or, clients will just throw on retinol or salicylic acid or something to just clear it for the day, toothpaste. But understanding that piece too. So making sure your whole body is healthy, then also doing things to take care of your skin at home. So just like we brush our teeth, we need to wash our face. You can add things in like retinols, adding things in like peptides, adding things in like vitamin C, or antioxidants, I should say, because vitamin C is not the only antioxidant, but those are things to help protect your skin and strengthen the skin and help it so that it can take on all of these changes. And hormones really do, they're going to bring out that pigmentation again. So we thought we made it through the pregnancy mask, and now all of a sudden we have our hormones going all over, and those fun things are coming back. So once again, if your skin is in a healthy state, then it might respond better to these things, and you can treat it better as well. And you're not treating it all at once. So it's not just a disaster happening all at once. But yeah, and it just is, be more pro-aging, not anti-aging, because we're going to get the wrinkles. Everybody gets different things, to be quite honest, and everybody has a different approach to it. And just be okay with it. It's okay if you want to just do nothing. And you do want to have healthy skin. You want to make sure you're washing your face regardless, and wearing SPF. But it's okay if you don't want to do neurotoxins, and you're okay with having wrinkles and aging gracefully and doing all that. Is okay. And it might not be okay for the other person, but it's okay if you do it. And just making sure too that self-care and making yourself healthy all over, and mental health, it can feel really selfish because we're doing that and taking away from our children and our household. But if we're not healthy and we're not taking care of ourselves, well, how are we taking care of other people and our family? And just normalizing that it's okay to do that and take that time away to do it.
Thank you so much, Stephanie, for that. I often feel like my face is melting as I'm aging. It's just like slipping down, but social media, the messages often are not positivity for aging oftentimes. So thank you so much for that, Stephanie. So once a woman has not menstruated for a year, she becomes postmenopausal. At this stage of motherhood, it's possible that the children have grown and the woman is venturing into a new time in her life with new visions and values. And Christy, I'm turning this over to you. As we've discovered throughout our conversation, each stage brings with it a transition. We've talked a lot about the grieving that we might experience. As a parenthood transition coach, would you begin our conversation in this area where you can provide some tips to the mothers out there about moving through the transitions with acceptance rather than struggle and pushing back?
Yeah, definitely. This is a beautiful question. It's also a very loaded question, so I will do my best. There's so much that we can do and be aware of, but I will do my best to keep it short. One of the things that we talked about before is this fixed time frame when we're going through this transition. And I want to allow the listeners and us on the call today just to give ourselves permission to lengthen those and understand that we are not on this fixed time frame for these transitions that we're going through and these changes that we're experiencing. I actually like to reference Life is in the Transitions. It's by Bruce Feiler, and what he writes about more specifically these transitions, and he calls them life quakes. And life quakes he defines as having a before and an after. And if you think about this, in all of these transitions and changes that we're going through in our womanhood, in our motherhood, there is a before and an after, right? So before we had no menstrual cycle, and after when we do get our menstrual cycle in our early teens, right? Or before when we were not a mother, and now when we are a mother. Before when our kids were at home under our roofs, and now when they are not and they are just visiting. Before when we're having a cycle, and after when we're in menopause and we do not have a cycle anymore. So just because there's a before and an after, it doesn't mean you are a whole different person, like in a split moment, right? It doesn't mean that we can't bring what was into what is now. So we need to bring ourselves through these transitions and find meaning and purpose in those things. And I think the significance and the length of these transitions or life quakes varies, but what his book notes and some other research on postpartum and how long it lasts does note very similar things, is that the average transition of a life quake is about 5 years, but it can take much longer depending on your personal experience. And so that's why I love this book. He has a lot of research, a lot of different ways to look at transitions and move through transitions. And so I've really used this in my own life personally and then with my clients as well. But giving ourselves permission to allow these stages and phases to be what they are is one of the best things that we can do. So some, I guess, general creative, but also practical things we can do to move through this is just remembering that we're in a period of recreation and learning what this is and means for ourselves. So self-compassion, we've talked about, that's come up. Grace, patience goes a long way. And similar to how you would give your child learning how to ride a bike, encouragement, compassion, a Band-Aid, an emotional support Band-Aid every once in a while. Like, give yourself the same courtesy when you're going through these transitions. A practical way of doing this could be a mantra. I'm learning, it's okay, I'm safe, I'm still good enough, even though it didn't go how I had hoped, or it's not going, you know. So the second thing I want to mention is also this is a time to reconnect to yourself, and it's important to do that during this time. We have this intuition that we're all born with, and it's a gift that we have when we're born with it. And I feel like it's sometimes beaten out of us as we go through life, right? Because we're forced into these narratives, these norms, these expectations from others around us. But finding and listening to it and understanding your personal needs is going to help you feel good and regain trust in yourself, because you are your best advocate. A practical way of reconnecting and still making progress towards your needs and your goals is actually doing a self check-in, whether that's weekly or it's daily. And I do this with my clients. And it's as simple as, you know, what are my basic needs? What is a win? What's going to make today a win? And what are my top 3 priorities? Or just one priority, depending on where you're at in that day. The third and second to last thing I want to mention, I know I'm so grateful that we've all kind of found this thread of grief in different ways, but grief is inherent with change and transitions. More often than not, we don't see grief and we don't allow ourselves to feel it. We don't, I don't think we recognize it because it's not talked about. And so giving space and understanding grief and that it's okay to grieve, it's okay to talk about it. You don't need to judge it. Your grief experience or your experience in general is different than someone else, and that is okay. Grief, something that I know about grief is that it demands to be seen, heard, and felt. And so if we're not paying attention to it, it's going to potentially manifest itself in unhealthy ways. So when experiencing grief in these transitions, it's important to understand how it could show up. So it could be sadness, it could be relief, it could be anger, it could be anxiety, it could be just feeling kind of blah. A lot of the things that have been said on this call related to mental health and even menopause, they get intertwined and intermixed with grief and your symptoms of grief, which is interesting. So it's helpful to go towards mindfulness and meaning-making activities when you're experiencing these transitions. These help you become more present, and they help you find purpose in your journey. And that's what we're all really striving for. I feel like in our hearts is that. So something practical you can do, and what I've done too, is find art therapy groups, get into yoga, go on nature walks, become more present. Something else you can do to find that meaning making is maybe write yourself letters to your old self or your new self. You can write letters to your kids about your experiences. So you're kind of handing over something for future generations, and they love hearing all of that, regardless of if you want to divulge that. They can read that, 20 years in the future. And then the last thing I do want to mention is leaning into your support network. And I know Brittni mentioned this when she was speaking, but support network in your care community, permission to be loud, permission to take up space and be seen when you're going through these things. You aren't alone. You aren't alone. You aren't alone. You aren't alone. And you do not have to be. Communicating and reaching out for support is imperative so you don't feel that isolation. And all of these providers on the call are here to help you. So practical things you can do here is to create a sphere of influence and really getting tactical with who's in your sphere of influence, who's your board members, who do you go to for what and when, and really getting clear on that. With your partner, have those hard conversations and explore what this might look for you with them. What is their role right now in this transition? What kind of responsibilities do you need them to take on? My husband and I have phrases, and we talk about jelly beans. So how many jelly beans do we have in my emotional jelly bean jar at the start of the day and the end of the day? We use phrases like tap out, right? I need to tap out right now. So what are these systems that you can create and feasibly utilize for your betterment and support through these transitions?
Oh, Christy, such wonderful advice. Thank you so much. Thank you so very much to each of our expert panelists for joining us today. The different stages of motherhood bring various different healthcare needs. It's important to have these discussions where we are having open conversations about what moms need to pay attention to. We appreciate each of you taking the time to come together and share your own unique thoughts and perspectives. Be sure to check out herhealthcollective.com for more great content from each of these expert panelists throughout the year. Thank you so much.